Welcome to Talking Dentures, where Simon answers all your questions about dentures.
Hello everybody, welcome back to Talking Dentures, and today we have got a question from Gaggy Gary. Gaggy Gary asked the question, do upper dentures make you gag? And the answer to that is yes, sometimes. Sometimes they can. In fact, I've seen a lot of dentures that are overextended in the palate. It's because it can be really difficult sometimes for a technician who's never seen you, who's making a denture, to determine where the dentures should be extended to, and sometimes they're just overextended. It's a really simple solution to just reduce the palate down in that area. In fact, sometimes what I'll do with some of my patients, if there's a risk of poor retention of the denture, maybe they've got a shallow palate or maybe they've got quite a dry mouth, in those sort of situations I will push the boundaries on where we extend the denture to see how they feel, because some people's gag reflex is a lot more pronounced than others, and so I might just push it to the boundaries, see how far I can extend that denture back, see how they feel about it. If it's making them feel sick when they're putting it in, I'll just trim a little bit off, try it again, and keep trimming it until a point where I feel like they're comfortable. However, sometimes I have a patient who will gag at just having the thought of putting a denture in their mouth. And so in those sort of situations, I usually start with a really small palate, hardly covering any of the palate at all, but still reduce it back to a point where they feel comfortable. However, it's important to say that in those sort of situations, you nearly always have to use a fixed level something to help hold that denture in, or another solution could be a couple of implants that the denture clicks onto so that holds it nice and firm, and then that way we can cut most of the palate away. But there is something I want to say about that gag reflex, and that is that it's a psychological reaction. Most people think that it's a physical reaction, so they're putting the denture in, the denture's going to the back of their throat, and the act of that physical reaction is what's making them feel sick. However, it's not physical, it's psychological, in that if you put food to the back of your throat, it doesn't make you sick. You can put the food right back there all the way and swallow it, and it won't make you feel sick at all, because your brain knows that it's food, and so it will allow you to swallow the food without making you gag. It's only because the denture feels like a foreign body, it feels like it shouldn't be there, the brain knows it shouldn't be there, and it wants to get rid of it, so it will make you gag so that you spit it out and get rid of it. It's a biological process that's hardwired into us, and I'm not diminishing it. I'm not dismissing the fact that it's not a real thing by saying it's psychological. What I'm saying is that the process of the gag reflex is one of self-preservation. It's what kept us alive. You put something bad in your mouth, your body automatically rejects it. So the trick is with a denture sometimes is about getting used to it. So wearing a denture, you first put it in, it makes you feel sick, but the longer you wear it, the easier it is to get used to that feeling of the denture being there. Not always, because sometimes it really is overextended and it's in an area that we call the soft palate. So there's a bony part of the palate and then it goes into the soft palate right at the back there. And as we talk, eat and things like that, this palate, it moves up and down. And as it's moving up and down, it's tickling on the denture, and that's what's inciting the gag reflex. So that's where we need to just reduce it down a little bit to stop that feeling. Sometimes there's a thick ridge across the back of the dentures where they've been made, they've not been thinned out properly. You know, that back edge, it needs to be really tapered in so there's a smooth transition from the denture into the roof of the mouth. That can help as well. So I've had patients where I've done that, where I've just reduced the thickness of the palate down, and that's helped a lot. The other thing that you can do when you first get dentures, new dentures, and if you're feeling like it's giving you that sort of gag reflex, is to have boiled sweets, because if you're sucking a sweet and you're getting all that flavour filling your mouth with your dentures in, your brain's registering it as food, this is okay, it's supposed to be here, and you kind of get used to having the denture there a little bit easier. So that's certainly a little tip that you should try. See if you can get on with that. If you really can't, then get yourself booked in with a clinical dental technician like myself. We can assess it, have a little look, and sometimes it's just a really simple adjustment, just reducing that length of the palate. But I will say one more thing actually before we go. Another thing that can cause it is not the denture being overextended, it's that the denture is unstable. When you've got an unstable denture that keeps moving, it's creating that same sort of reflex that you can get if the soft palate's moving. In that if the denture's moving in your mouth, your brain's registering it. It's difficult for the brain to forget that it's there if it's constantly moving. So that's another thing that can cause it. So there are solutions, there are some easy fixes, and there's some other more difficult workarounds. There's usually a solution for it. I hope you found that useful. We look forward to more questions from you, Gaggy Gred, and we'll see you in the next one.
Thanks for watching, and don't forget to send us your questions. There's a link in the description below. Bye!